this is live, so you can invite people, you can share it on LinkedIn, you can do all this as I'm bringing up our second guest here. So this time we got two presenters. I've got Nancy and Daniel, and they're going to be talking about, well, let's see. We got another healthcare example. So you've got a big hospital system, 57 across the board, clinical, non-clinical staff. All right, well, so you've got some operational challenges as well. And so I'm looking forward to this. You are live, so I'm going to hand it over to you so that you can do your thing, but I will be right here if you need anything.
Thank you and welcome. Yes, Daniel and I represent Advent Health. Daniel put together a fabulous PowerPoint for us, so he'll bring that up in just a moment. A little bit about me until he gets that up. My name is Nancy Copenhaver, well, Maldonado, because I just got married, but it takes forever to change your name. So eventually it will change.
Congratulations on that, by the way.
Thank you. So let's see, I work for our Central Florida division. Advent Health is huge. We are across the United States. Daniel's in our corporate department, so he influences, well, we all influence everybody actually with 7 Taps because it's so easy to be able to send to anybody across our organization. So he's corporate, he'll introduce himself in just a moment, but I'm in our Central Florida division where it's already very hot in Orlando. And I am part of the nurse professional development team. So I do content and competency kind of management for this part of the region. So hopefully he can present and he can share as well. We love technology.
That's how it goes. That's how it goes. So thank you for the introductions and everything, Christopher. I'm Daniel. I'm the instructional designer. I'm one of the instructional designers for our Center of Expertise and Learning at Advent Health. Our main focus is digital learning across the organization. Our main are effectively those courses that will apply to all of our employees. So Nancy mentioned that she specifically works with our Central Florida division with nursing. So we'll be able to, through my portion, get a better idea of how we even got to 7 Taps. And then Nancy will show us a real example of how our nurses are benefiting from this tool. All right, if we can transition over a couple of slides over to slide 4, I think we're going to be good there.
Mm-hmm.
All right, so starting off, you saw a couple of the statistics. Advent Health, we are over 100,000 employees, team members across 9 states, various areas, various areas of expertise and levels within the organization. So one of our challenges is effectively how we can disseminate learning to all of our employees across this vast system in a way that is accessible to them. And our primary focus traditionally has been that learning where we embed our courses in our learning management system, and that's how we effectively reach our employees. The challenge with that, unfortunately, is some of our employees are in that healthcare space. They are actively taking care of patients. They are actively going from one room to another, and they don't necessarily have the time nor the technological resources available to sit in front of a computer for hours on end to complete this learning. This is where 7 Taps will come in our story. We do have instructional designers as well across the organization, but what we're finding more and more now is that we're enabling, excuse me, we're enabling partners at various levels to become more a part of that conversation. Our digital learning lifecycle is a process that we've created where we've been able to streamline our intake of any training needs across the organization to flow into this uniform, standardized process where we can then, in our corporate world, we can then collaborate with stakeholders across the organization, stakeholders within that area of expertise. So our subject matter experts, our nursing professional development managers like Nancy, and we can involve the relevant stakeholders in this conversation to ensure that a couple of things happen, that there in fact is a training need that needs to be met, that this isn't just something that could be sent in an email. This isn't something that could be communicated in a different way, that there in fact is a training need. And not only that, but with our vast system and the more we try to enable learning designers across the organization, the more opportunity there is for content to be created, right? We want to make sure that the content doesn't become duplicative in nature. We want to make sure that if there's already existing content in the organization, we're not duplicating work. We're not wasting anyone's time. We're not wasting our team members' times. They can focus on their roles, on their primary roles, and they don't need to do something, recreate the wheel, or create something that already exists. So that is our dynamic learning lifecycle, which has helped us to streamline content and such. And in those conversations, we're realizing our team members' needs, especially in the clinical setting. Um, our conversations around 7 taps began, and we started having. If you want to move on to the next slide, please. So this is effectively the process that we went through with our content harmonization and creating that digital learning lifecycle, where all that content ends up becoming this cleaner catalog. We can make clearer decisions on whether or not something is a training need, and we end up by default building stronger relationships with partners across the organization. So it makes it easier to maintain courses over time. If we can transition one more, please. And this is effectively where the conversation with 7taps comes into play. 7taps, as wonderful of a tool as it is not our solution for all learning need problems. It is something that we very intentionally leverage and utilize in the space where it makes the most sense. So where we end up finding where we have formal training needs that we need to report on, like compliance, for example. Those are courses that we generally want to disseminate through our Workday learning management system. If there's any structured e-learning needs, we do utilize Articulate products to create some of our more formal courses. And 7taps does come into play when we have some of those reinforcement process, when we have those needs where we need to reach our employees in a space where they aren't able to sit in front of that computer, where they might have access to flip through the course on their phone between patients, or get that learning, that just-in-time training. And of course, if there's any step-by-step references, we end up building out a lot of job aids, a lot of quick reference guides, as we refer to them, and different standards and such to help not only our employees learn what they need to know, but even enable some of our designers. These are a lot of resources that we're creating for ourselves as well, to kind of provide those guardrails that we're going to see in just a moment. And if it can just live in an email, it's important to realize that the decision on how to solve for a problem comes way before you select a tool to utilize. So realistically, based on the learning needs, that's going to determine what you utilize. So 7taps ends up becoming a part of the family, a part of that learning ecosystem that we utilize at Advent Health. We can move over to the next slide. Okay. So as I mentioned previously, the 7taps really helps us to address a gap. It really helps us to address a need, and I'll touch base a little bit on that buy-in process later, because there were conversations that were had across the organization to gain that buy-in. So we'll touch on that in just a moment. But some of the guardrails that I mentioned earlier, we at COE Learning, we like to create standards, not to necessarily like force anyone to design a particular way, or tell people how to do things, but realistically we want there to be a general understanding of best case scenarios on when to use these tools and how to use these tools. We try to provide the tips and tricks. We have a process that we're working with now. We're working hand in hand with our designers to upskill non-traditional designers that we're enabling, uh, helping them learn how to use these tools at an expert level so that they could confidently develop learning where the work is happening. So effectively, we set up standards, we set up these quick reference guides, and this is just an example of how we have conversations around 7-taps, like when 7-taps is most beneficial to our employees. If there's a course that has a single outcome or very, very streamlined content, very simple content to digest, the 7-taps is great. Any courses we try to keep around 3 to 5 minutes. Again, we want it to make sure that we get to the point with the learning. We're not wasting anyone's time with the fluff of we need to know everything all the time. That's just not the case with effective learning. We want to make sure our employees get the information that they need to know at the moment that they need it. We have created branded templates that employees can use. Anyone with a 7-taps license at Advent Health has access to backgrounds for all the cards. They have access to different kind of scenarios for each of the cards, and this helps enable the designers as they're creating their courses. And as I mentioned, with our dynamic learning process or our dynamic learning lifecycle previously, there are clear owners at this point at every stage, and team members that we could collaborate with or reference as we're designing. And of course, once you get those metrics and you can utilize that to edit and update your courses in the future to improve. We can move on to the next slide. So one of the biggest questions that a lot of organizations has is effectively how do we get buy-in? How do we get the company to pay for this effectively? And it's as simple as a conversation, but it has to be a very intentional conversation. This is effectively multiple conversations with as large as the conversation was, the organization is. These are multiple presentations across various areas. And one of the things that helped us significantly is 7-taps has a page on their website with use case scenarios for various industries, various organizations. It gets very granular in terms of the information that they provide. So we utilize that to customize to our needs, and we present it to different areas, the nursing side, and our leadership institute as well. We presented to there were a couple of different areas that we're presenting this tool to, and each conversation effectively revolves around the intentionality of 7-taps. And the real question that we're trying to answer is like, what problem are we solving for here? Whenever you're trying to get that buy-in, you do want to show them an example. Those 7-taps use cases help if you have if you need a starting point. But definitely customize it to your organization and your needs within the different areas, and set up a pilot, set up a sample of what that might look like and what problem that might solve for. Be very specific in how you're addressing that problem, and of course share the results. Like once you get up and running and you get going and you get that traction, make sure to tell your story, tell your success story, let people know that, hey, this is working. It's gonna kind of improve on that buy-in. It's gonna help out a lot. So just to wrap up my portion here, there's a couple of lessons that I want you to walk away with. Just start with the right decision. Make sure that before you decide on a tool for your solution, you're ensuring that you're solving for the right problem in that scenario. Make that path safe for everyone, for your employees, for your designers. Create those guardrails, create those processes, those standards, those templates, the branding, everything that will be necessary for a successful course design. And then, of course, as you're collecting your data, don't just collect for the sake of collecting data, but collect it to create that story, share that success story. Let everyone know how not only the tool is beneficial within the organization, but how you're affecting your employees' lives and ultimately your clients' lives, which for us is our patients, how we're benefiting their experience all around. So with that, I will leave it to Nancy to give us that practical application. She's going to share a wonderful
Thanks.
example here.
I have, I would like to share my screen in just a moment. So to piggyback on pretty much everything he said about the multiple different platforms that we have, in my role as a nurse professional development, at the regional level, I support all of the nurse professional development folks on campus. So anybody who does onboarding, does competency management, checklists, make sure our nurses and techs know what they're doing on the floor to take care of our patients in the best way that we can. I support all of them in the region. So I recently joined the regional team back in December and January. In January, I got the 7TAPS license. And then within a few weeks, everyone started reaching out to me saying, I want education. I want a 7TAPS. So I had to very quickly figure out how to manage and prioritize all of the incoming requests. So I initially had this great little forum that follows the 7TAPS layout. So it was very easy for them to give me the content. And like Daniel had mentioned before, we have multiple different systems. So our Workday Learning is for our competency management in my world. And then I work with the team that does Articulate that designs all of those as well. I do 7TAPS. I also do work on job aids, and I also work on the quick reference guide. So I do all of those pieces with NPD. So we have a really good understanding of what is used for what purpose. So I very quickly realized anybody who has a request for 7TAPS, we need to have an initial meeting, because I very frequently describe and have to educate on, okay, I can't do this in this manner because you want a competency and you want tracking and you want to make sure that you have everybody gets this understanding. 7TAPS is not set up for that. It is for that reminder. It's for that quick information. So that was my first hurdle that I had to get over is, okay, I need to educate on the different types. Now, once they learned I can also create Workday Learning modules, then I just gave myself more work because I can do a little bit of everything. However, 7TAPS for the focus here is for the quick content. So I have an example. I don't know if I can share my screen. I don't know if we can do that.
Yeah, there you go.
Yeah, sure. Okay, so I'm going to share. So one of the benefits of working in the role that I'm in is that I reach so many different learners. So originally I'll have requests from clinical managers. So they'll call and say, oh, we have a fall risk. We have a new vascular surgeon that's coming in. We need content on quick references, information on fall risk, those kinds of things. So I've developed lots of clinical quick learning for them, depending on what is needed on their unit, which is great. And I get to meet all the managers, subject matter experts. I love to talk, so it's great. I get to meet so many people from the clinical side. But because my role supports so many different departments, I get to reach more than just our clinical partners, which is fabulous for me. So one of the things I got to do, this is a request from our senior vice president. She's also over Advent Health University that we have. So she wanted a 7TAPS that explained how nurses can go back to school 100% online through Advent Health University to get their BSN. So this was fabulous. So I put this whole thing together. They liked the videos. For you that are in different countries, for some reason, the United States loves British accents. So anytime I use a video with a British accent, everybody thinks it's the best thing ever. I don't know what it is about the United States. But this university is great, and it reaches all of our nurses in all the states, especially since our Advent Health University is online 100%. Any nurse can look at this at any time, and it's paid for through the company. It's one of our benefits. We love to elevate our staff in general. It doesn't matter, not just nurses, but anybody. So it was fabulous to work on this and to reach not only, my region, but everybody in the company. The other big project I'm working on too is that now we're branching into our patients. So as nurses, we have our patients that have chronic diseases. They'll come in, they have heart failure, and the patients come in and they're really confused. When do I call my doctor? When do I go to urgent care? When do I come back to the hospital? What do I have to look for? So they created these tools that they use on discharge for how to assess yourself at home from the patient perspective. And we translated them all into 7 taps in English and Spanish. So now we're getting to the point of reaching out to our patients so they can take care of themselves better at home and do the right appropriate care depending on what their symptoms are. So we're really branching out clinically to try to help our patients and improve our outcomes and have them stay home and take care of themselves if they can, or they can call their doctor. They don't have to come to the ER if their doctor can help them. As a nurse, I've worked with so many patients that just don't understand the medical world. So we're trying to make sure they know how to care for themselves as much as they can. So I get to work with lots of different people in lots of different ways with 7 taps. It has been fabulous, so easy to use and design. I am definitely for the AI component to help put it together. Ezra was great. I sent in a message to the team going, I can't figure this out. And he answered my question in about 2 seconds. I was very excited about it. So the support that I get through the 7 taps team is also fabulous. So I get to use it. I'm really excited to learn more about it and become an expert over time since it's only been a few months. So, and hopefully I'll get to work more with the corporate team too. And we can all work together. So that's the clinical application that I get to do pretty much on a daily basis.
I love that. I love that. Well, first of all, Nancy and Daniel, can we get a round of emojis for you sharing? And hey, we overcame the technical difficulties. We're able to talk through, just the example you had. So thank you so much for bringing that. For time's sake, we're gonna quickly transition, but thank you so much for sharing and also sharing the example. I think one of the things I do just want to highlight though that you added was not only the tool and how you're using the tool, but I will say, and they're not paying me to say it, like I just really love the team. The team makes a huge difference in terms of some of the challenges that you have. Like there really is, like this event is kind of representative of the community that is supportive when it comes to 7 taps, and you feel that. And I know I do as well when it comes to anything. Like you need something like, I'm always surprised when I have to send something through chat and Ezra responds at 2 a.m. I'm like, what are you doing? Like, why? I wasn't expecting you. So I love that. So thank you so much for sharing. I'm going to bring up our third guest. Thank you, Nancy and Daniel. Can we get one more round of emojis?